So as he had mentioned earlier, types of pain. There's axial pain, which is the neck and back pain. And then there's radicular pain, which is the pain you feel in your arms or legs due to that pinched nerve. And so just to rehash the anatomy, we have the central canal, where all the nerves and the spinal cord run. We have the foramen, which is the little hole where the nerve comes out at each level. We have the vertebral bodies, as we discussed, and the disc in between. And all these things come into play as we're looking at conditions that will lead to something that may need surgery for treatment. One common condition that leads to problems is stenosis. Stenosis just means narrowing of a tube. That is caused by pressure in that central canal, and that can be due to different things. So that whole tube is surrounded by different structures, and either the disc can be bulging and pushing on the nerves or the spinal cord, depending on the level, or whether it be the neck or the back. And so a lot of people will come in with this condition, is that your legs will hurt when you walk, and it feels better if you sit or if you bend forward. And so one of the classic things people say is that if they're leaning over a shopping cart, they can walk a lot farther than if they were just standing. And so one of the first things we do is get x-rays, and often we'll get an MRI, because an MRI will really show you the amount of space available. It'll show you the soft tissue structures you can't see with an x-ray, such as the discs. Now, sometimes you can't get an MRI because you have a pacemaker or some other sort of issue that will keep you out of the magnet. And in those cases, we can get a myelogram. It is a CT scan, but they will also inject dye into your spinal fluid, and it gives us very good results as well. Well, there's lots of things you can do short of surgery. Physical therapy for strengthening of your muscles, medications to treat those symptoms that you're having, and sometimes the epidural steroid injection, as we talked about before. If it comes to surgery, the classic surgery for this is a laminectomy. And so what that means is you're removing the arch over the tube to make the tube bigger and take away the things that are pressing on the nerves. And so this is a diagram showing a laminectomy. This is the tube running up and down. The yellow represents the central canal and the nerve roots there. And this is what it looks like to open up that central canal. Sometimes the fusion might be involved if you had a slip. So a fusion is a procedure where you want to get two or more bones to grow together into one bone. You may require screws and rods, or maybe it's just bone graft, depending on your situation. Nowadays, we use screws and rods at each level, able to get better purchase, better correction. So sometimes you want to take out the disc, too, for various reasons. It gives you additional area for fusion. Sometimes the disc itself is the problem. And there's different ways to do that. You can come in from the front. You can come in from the back. You can come in from an angle. You can come in directly from the side. Or you can come in a way we'll discuss here in a minute. Coming in through the front, typically you have a vascular surgeon does the approach. They're used to getting in that way because they deal with aortic aneurysms, and you're right down in that neighborhood. So they get you down there safely. You take out the disc. You put in the cage. You can come in through the back. So here you see little cage on each side, and it's a similar idea, but it's a different technique of getting there. There's the transforaminal, so you're kind of coming in at a 45-degree angle. So instead of coming straight in the front or straight in the back, we're coming in at 45 degrees. And you typically put in one cage, a longer cage, either a banana-shaped one like this or a long, straight one. The X-lift, this is where you come in straight through the side. And the incision is actually right here, little incisions, and you come in straight down. So that's kind of a cross-section. And then another one, you can actually come in right under the sacrum. So this is a little incision kind of at the bottom of your butt crack. That's about as minimal as it gets.